Modern medication did not work for me. Modern medication did not work for me. Modern medication did not work for me. Modern medication.
Good evening, everybody. Thanks for coming. I really appreciate it. This is a very timely forum we're having, considering the commissioners just addressed this issue in their last meeting, and the City Council of McMinnville addressed it 2 nights ago in their meeting. So I'm happy to have you all here. I will make one apologize right off the front. Our one panel member, Todd Delato, was unable to get back from Ashland today, where he was a speaker at another conference. So we brought in Andrew Gwynn, who is a facility owner in Southeast Portland. So, all right, so we're gonna get started. My name is Anthony Taylor, and I will be the moderator for this evening. And I am the co-founder and current director of Compassionate Oregon. And as I said, we're very pleased to be presenting this panel this evening. And I want to thank McMenamins, of course, for providing the venue, and our elected officials for taking time out of their very busy schedule. We slid it in between one annual dinner last night and the Mayor's Ball Saturday night. So thank you very much for coming along. I'm also pleased tonight to introduce the other founding member of Compassionate Oregon, Cheryl Smith. Cheryl Smith is in the office, if you wouldn't mind standing in the audience. Cheryl is the executive director of Eugene's Compassion Clinic, serving medical marijuana patients in Lane County and the surrounding area. She also sits on the advisory committee for medical marijuana. She is an author, an attorney, and was a primary drafter of the Oregon Death with Dignity Act, and we're very pleased to have her. Thanks for coming up from Eugene tonight. What we're going to do this evening is give everyone a brief summary of the law regulating medical marijuana facilities, which takes effect March 1st. I know some of our audience members know a lot about this issue on both sides, both pro and con, but more importantly, though, we're trying to reach those people that don't know how the law works and have some concerns and are looking for some answers. So we're also going to try and wrap it up sooner than later, so when you get a chance to ask a question, please be concise and stay on point. Don't start talking about growing marijuana in Southern Oregon when we're talking about medical marijuana facilities here. So, also, please keep in mind, it's an instructional panel, informal event. And so be polite, try not to interrupt, be respectful, and of course always be compassionate. So to start, we are going to present a few slides that we hope will bring everyone up to speed that doesn't know much about the law. And after that, we'll bring the panel up, introduce them, let them offer a brief statement, and then I'll start throwing some questions at them. There are cards being circulated in the audience if you want to write a question down. We will get those cards up front. Also, let me just back up for a second. There is water in the back. You're certainly welcome to that. There are a little information table right at the entry where we have our brochures and our donation envelopes. Please feel free to fill them fully. And then Bernadette Hansen, she will be our floor person. She's back there in the back, and she will be making sure your cards get picked up and making sure that when you come up the microphone, you get a chance to get up there, and she'll help you keep your questions brief and to the point. Okay, so a few words about Compassionate Oregon. We founded last year to advocate for the rights of medical marijuana patients and their families. This advocacy seems rather important now as the state begins to be trending towards legalizing recreational use by adults. As this happens, the trend will be to move away from medical marijuana programs, as we have begun to see happen in Washington. We believe that the therapeutic value, however, of cannabis will continue to help many people, and the law we are here to discuss tonight will play a major role in providing safe access for those medications. Many of our Yamhill County patients, currently numbering over 1,000, are not able to provide for themselves and have no grower to provide for them. This law will help provide that access. Compassionate Oregon worked a lot in last legislative session, and with the help of Senator Boquist, we introduced and passed Senate Bill 281, which added PTSD to the list of debilitating conditions for the use of medical marijuana. We hope that the veterans out there that need help will now be able to get it, and any first responders or any people like that that are suffering from traumatic stress will be able to get some relief. Several other changes in the statutes dealing with marijuana were passed last session as well, including sentencing reform for marijuana-related offenses. One of the biggest changes, however, was the licensing of medical marijuana facilities, and that's what we're going to talk about this evening. So, let's get started. This is our agenda. We're going to have, as I said, some opening statements, and then the introduction of panel members, questions for the panel members, and then we'll kick it open to the audience. Compassionate Oregon is an Oregon political action committee dedicated to protecting the rights of medical marijuana patients and their families. We also work for sentencing reform and elimination of minimum mandatory sentencing and discriminatory policies based on conviction for drug laws, and we support the implementation of the medical marijuana facilities statute. When Governor John Kitzhaber signed the bill into law, he said there are two main goals we wish to achieve. First, we want to ensure the overall safety of our communities through appropriate rules to license and regulate dispensaries, and second, we want to allow the patient safe access to medical if they are eligible for treatment under the Oregon Medical Marijuana Program. He also said, I believe it will be critical to set fees for dispensaries that will provide sufficient funding for OHA so that they can be extraordinarily vigorous in their enforcement of the rules that are developed. I highlighted or parentheses the OHA because that's what he was talking about. Sometimes this particular paragraph gets confused. That is law enforcement's job to vigorously enforce these statutes, which it's a partnership, of course, but try that door on the end, please. It's a partnership, but the OHA is the one that's responsible for administering the program, enforcing the laws, and regulating the dispensaries, and they are tasked with doing it vigorously. So if they come into a dispensary and things are out of order, they're not tracking everything they're supposed to be tracking, then they will be written up, and there is a possibility they could have their license revoked. So, the law. It was originally House Bill 3460. It was added to the statutes that deal with the Oregon Medical Marijuana Program. Oops. Wrong button. This is the law. The Oregon Health Authority shall establish by rule a medical marijuana facility registration system to authorize the transfer of usable marijuana and immature marijuana plants. The preamble to the administrative rules say that a person may not establish, maintain, manage, or operate a facility without that license. And it does not in any way protect anybody from possible criminal prosecution under federal law. Okay, so that's the law. Here are the rules. And there are a bunch of them. Way too many to put up here and bore you all with. But here's the highlights. Cannot be within 1,000 foot of a public school, private elementary, secondary, or career school that is attended primarily by minors. Now, I know there's some concern about preschools because just recently in Portland, a facility was sited directly across the street from preschools But in legislation that was passed this last session, they addressed the 1,000-foot rule and more clearly defined it, and they left preschools out of it. The primary reason for leaving preschools out is because typically preschool-age children are under the supervision of their parents when they get dropped off and when they get picked up. It's not like in junior high or middle school these days. In high school, where the students are just released and they go running around the neighborhood and they go across in front of them. It's kind of tricky because typically a school is within a residential area, and you're not allowed to site a facility in a residential area anyway. So you can't be located within 1,000 feet of another facility. This is to minimize grouping, like was happening in California and in Colorado as well. They felt that one every 10 or 12 blocks would be plenty. Minors are not allowed in any area of a facility where marijuana is present. The rules require an entry room, you know, where people can come in and have intake taken, and that room has no marijuana in it, and that is the only room a minor is allowed to be. They can't be any place else in the facility. No use of marijuana on the premises. The only exception to this is if an employee is actually a patient and needs to medicate while at work. He is required to do that out of sight of the public behind locked doors. More rules. Must be located in an area that's zoned properly. You can't be in a residential area. You have to be in commercial or industrial or mixed use agricultural area. And you cannot have a dispensary at the same address as a grow site. So if you're growing plants in your house, you can't have a dispensary in your house or, you know, your business. All facilities must test for mold, mildew, and pesticides and keep all lab reports for all testing results. This was a very big concern when this bill was first drafted because there has been some reports of people with asthma or other breathing conditions that can be troubled by this, mold spores and mildew, and of course pesticides, we all know the story there. So that was written into the statute for sure, and it is elaborated in the rules. All usable marijuana must be labeled. You have to be able to look at the label and tell what percentage of THC is in the package. It also requires CBDs. That's a little technical, but those are the types of, you know, the many 400 chemicals in marijuana. That's one of them that helps with anti-inflammatory issues and things of that nature. And finally, it must include a warning label. Got to have that label on there, and it has to be bigger than any other letters on the label. So when you pick it up, that's the first thing you should see. How much is it going to cost a facility owner? Well, it starts off with a non-refundable application fee of $500, and this is to pay for the Oregon Health Authority's background check, criminal background check that they have to perform on the person responsible for the facility. It also will help cover inspections and getting the application forms together and all that sort of stuff. Then you have to step up to the plate once you've been authorized to get or issued a license and pay this much money. $3,500. So if you're going to open a medical marijuana dispensary in Yamhill County, that's how much it's going to cost you for your first year. Second year looks an awful lot the same. That's a renewable fee, renewable application fee, because they have to run a background check on you again. Every year the authority is required to run a background check. The last thing is the additional startups costs required by rules. The rules require that you have to have a good security system with cameras and recording so that all that video can be stored and looked at later by authorities if they need to. There's all kinds of stuff. You have to have commercial grade locks on all your entry doors, and you have to have a point of sale software that enables every purchase, every transfer in or out of the facility to be recorded so that the authority can take a look at your records and make sure you're doing things the way you're supposed to be doing them. This is how the Oregon marijuana program works. The Oregon Health Authority is the overarching agency that looks after the Oregon medical marijuana program. Originally, it provided cards for the grower. Well, let me back up for a second. The patient and or his caregiver, and then a grower. The patient, the only way a patient could get marijuana was to grow it himself, find a grower that would grow it for him, or find some charitable soul that would give them their marijuana. At that time, the patient, the only money that was allowed to change hands was from the patient to the grower, and you could only reimburse the grower for the cost of his materials like his dirt and fertilizers and his utilities. You could not give him any money for labor or other costs of doing business like insurance costs and packaging and processing and all that sort of stuff. And so that's why you see the red, the reimbursement, that's the money coming from the patient to the grower, and the marijuana going from the grower to the patient. The patient is allowed to have 24 ounces of marijuana at any and all times, and that number is actually can be divided between the grower, patient, and caregiver. Between the three of them, they're not supposed to exceed the 24-ounce limit. So last session, after years of complaining by the growers and the patients, and now the facilities, because some of them had set up and were starting to dispense cannabis to patients with no charge. They weren't adding anything onto it. If they got it for $4 a gram, they were giving it away for $4 a gram. So it was problematic. And so last session they sat down and they created the medical marijuana facility and PRFs, persons responsible for facilities. The PRF must be background checked, including fingerprints. He has to go through a whole lot of stuff. There's a lot of hoops to jump through on this statute. The medical marijuana facility can now take in marijuana from a grower and distribute it to a patient that has no way to get marijuana. And the patient can give money to the facility, and the facility gives that money back to the grower. You are not allowed to make a profit, but you can figure in your normal cost of doing business. So if you buy from a grower marijuana that's costing you $7 a gram and your cost of doing business is $4 a gram, you can only charge $11 a gram because you can't substantiate anything else, and they don't want anybody making money off of the transfer of marijuana. That's illegal. So that's where we are right now. That's how it works. And just a couple other quick things and we'll get the panel up here. This law has been controversial right from the start. They think it will be, well, first of all, there are some flaws in it, as some of the people have pointed out already. But they're going to let it work for a little while and see what happens. With respect to that, a lot of the local ordinances like Medford and Ashland and Corvallis have talked about it. The city of McMinnville 2 nights ago have talked about an outright ban on this. But according to the Legislative Council, we conclude that HB 3460 preempts most municipal laws specifically targeting medical marijuana facilities, and a municipality may not act contrary to state law merely because the municipality believes that the action will be better carry out the purposes and objective of federal law. So that's what the Legislative Council has said. The League of Oregon Cities and the Association of Oregon Counties differs with that, and they have a different interpretation. And so this next coming session, they have introduced a law that will allow local municipalities to regulate, restrict, or prohibit dispensaries at the local level. So that's about it. Let me bring up the panel. We're gonna, let me get back to the bio pages and all that. And why don't everybody just come on up and grab a seat, and then I'll introduce everybody. Nice round of applause. Again, I am very, very honored that these elected officials can take time out of their schedules to come up here and participate in this. We're going to start on the far end with Andrew Gwynn. He is a facility owner and operator that is right now, bringing his facility up to speed. His facility is in southeast Portland, and he is really doing everything he can to get all the cameras in place and all the things that the rules require. And he started a chapter of Students for Sensible Drug Policy at Chemeketa Community College while a student there. And if you have any computer questions, write them on the card, he'll answer them after. The next is Annette Frank. She is a Dayton City Council member and was elected in 2012. Annette has a bachelor's degree in environmental sciences with an emphasis on policy. She has been involved in her community for the past 10 years and is currently a city councilor in Dayton and the secretary-treasurer for the Friends of the Mary Gilkey Library. Okay. Next, Commissioner Stern. Commissioner Stern was elected to the Yamhill County Board of Commissioners in 2002 and is now serving her third and final term as commissioner and serves as the chair of the commission. She also currently serves on the board of directors for the Willamette Valley Commission, and in November 2012 became the first ever Yamhill County Commissioner elected as the president of the Association of Oregon Counties. Mary currently serves on the board of directors for the Willamette Valley Cancer Foundation, YCAP's Resource Development Committee, and the Oregon Criminal Justice Commission. Sheriff Jack Crabtree was also elected in 2002 after a long and distinguished career in the Yamhill County Law Enforcement Sheriff's Department and is also serving his last term. He is a member of the National, Western States, and Oregon State Sheriff's Association, has been a corrections officer, a patrol deputy, and a detective. He has served with distinction and been honored for Outstanding Achievement Award and Investigator of the Year by the Oregon Police Officers Association. Sheriff Crabtree was a member of the Rules Advisory Committee that helped write the rules for this law, and he is currently chair of the Yamhill Interagency Narcotics Task Team. Thanks everybody for coming. Thank you. Since Mary is at the top of the chain in the county, we're going to start with her and let her do a little bit of an opening statement. And you'll have to share the mic, but we're used to that.
Well, hi everybody. Can you hear me okay back there?
Yeah.
Okay. I'll put my glasses on so I can see you in the back. If we're not loud enough, just wave and I'll try. I have a big mouth. I'm really glad to be here today. What Anthony didn't tell you is I'm also an attorney, graduated law school in Boston and then worked for the Federal Bureau of Prisons and came to Oregon because I was a staff attorney out in Sheridan. This is such a complicated situation that's going on now with these laws. There's a lot of differing state law regarding land use, regarding agricultural use, regarding whether local jurisdictions can even regulate seeds or nursery stock, which marijuana is considered a nursery stock. So, and there are so many questions that are floating around about this. You know, can we keep the public safe? In the rural areas, are there many areas where we could site these facilities? We don't have a lot of commercial or industrial area in the county, in the rural areas of the county. And we had a meeting last week. I had asked that the sheriff and the district attorney and the two commissioners, our county council and assistant county council, and our planning manager come and sit together and talk about possibilities. You know, what can we face? What do we know? What don't we know? And it's, we're in limbo right now, is how we feel, as are the folks who are interested in applying for dispensary permits. I mean, they don't know what we want to do. We had Jim come to us in November, I believe, and ask, what are your plans? And we couldn't meet until January to really sit down and talk about them and try and figure this out. So the first thing I want to tell you is that we have a public hearing planned for next Thursday at 10 a.m. in room 32 of the courthouse. And we're hoping to hear from as many people as possible to hear what you have to say about this. And we apologize, it's during the day. For those of you who can't make it, you're welcome to send in any written comments. Would appreciate those. If you go on the county website, all of the commissioners have their web addresses, their email addresses up there. Or if you just send it to me, and I'll make sure we get copies for all of the commissioners and for all the staff who will be attending that meeting. But you know, I'm interested in hearing the discussion. I will tell you right now, my father-in-law is back in New Jersey and has been undergoing cancer treatment for the last over a year and a half, almost 2 years. He has bile duct cancer, primary, and liver cancer is a secondary, and has had some others floating around. He's not hungry. He can't eat. He doesn't know what to eat. My mother-in-law is just beside herself trying to figure out, what do I cook? She cooks everything. She tries everything to try and find something my father-in-law will eat. He's going to be 72 years old. That's young, and it gets younger every day, and was up until the cancer, the healthiest person I've known. So, you know, I understand the compassionate side of this. I worry if he were here, now he's a federal judge, so I don't think he'd be smoking any marijuana, but if he wanted it, and was here, how would he get it? And I would want him or me to be able to go to a pharmacy, a dispensary, and be able to purchase it for him in a safe and secure place. But so there are all the. Then on the other hand, I've been the liaison with the sheriff's office for many years, and we've worked on this evidence-based decision-making initiative, really trying to ensure that we're doing the best with your tax dollars to have a safe and secure community, yet being effective with the way that we handle our criminal justice system here. So I worry about the impacts of public safety. So it's a difficult position to be in. I'm interested in hearing what the panel has to say and hearing what all of you have to say as well.
Thank you very much. Well, you're next on the pecking order, so Sheriff Jack Crabtree.
Above you on the pecking order.
No comment. No, thanks, Anthony. I really do appreciate you inviting me to be on this panel. Can you all hear?
Now we can.
Yeah.
Sorry. I appreciate the invitation. I really do. This is House Bill 3460. Was a bill that was sponsored and promoted by Representative Buckley, Senator Brzezinski, Representative Frederick, and Senator Dingfelder in the 2013 legislative session. This was a law that was not referred to the voters, but simply passed by legislators. As you've heard, the law basically allows for medical marijuana dispensaries to open up throughout the state of Oregon. The law actually came into effect in July of 2013, and I was asked, of course, the OHA, the Oregon Health Authority, was tasked with putting rules together to regulate the dispensaries. Excuse me. I was asked to sit on that Rules Advisory Committee as a representative of the Oregon State Sheriff's Association. The group basically consisted of 13 people. 2 were law enforcement. One was the Chief of Police of Corvallis, John Sassaman, myself, and then we had a district attorney from Lincoln County, Rob Bobette. Our task was to provide the OHA with guidance and suggestions on how to properly implement the House Bill 3460. The problem that I see, and I'll hold my issues until I'm sure we'll be asked, but just kind of a general sense of the actual Rules Advisory Committee, which is referred to as the RAC. One of the issues that we'll talk more about later that I had, and I know the other the DA and the other chief of police had as well, is that we were limited in terms of what we could suggest for rules regulations to what the law already had, placed in law. For example, if the law said only so much money can be collected, we couldn't suggest that they allocate additional dollars to the program to make it effective. That's an example. The law is the law. We had no ability whatsoever to change the law at that point. So I just want to make that clear, because when people see my name on that committee and they see the final rules, I want you to understand that we had some very tight constraints on what we could and couldn't do. Anyway, so the idea was for us to meet, which we did, and the OHA director was to finalize the rules, and they'll start asking for application with, I think, the 3rd of March or so. And then sometime after that, dispensaries will start opening up. So I put together some concerns that I have about dispensaries, and we'll get into that more later. But following what Commissioner Stern said about compassion, I had my grandmother, who I loved dearly, also had cancer. She fought it for 9 years or longer. She had every cancer known to mankind, and I can tell you I'm very compassionate about people who have cancer, but I also know that my grandmother, if she were alive today fighting that cancer, that there are absolute alternatives to her getting her medicine than to get that at a dispensary in the city of McMinnville or anyplace else. There is an Oregon medical marijuana law that allows growers to supply marijuana to those who want it, and we'll talk more about that later. But in terms of compassion for people who actually need help, I'm there, so I don't want any confusion on that. So I'll stop there.
All right, thank you. I would just like to add to Sheriff Crabtree's comments about the Rules Advisory Committee. Rules Advisory Committee, they convene to advise the Office of the Attorney General what rules they're, to help them write the rules, but it's really the AG's office that writes the rules. And there was many occasions where DA Bavette and other people raised concerns that just fell on deaf ears because the AG wasn't going to write it that way. And so it was frustrating for law enforcement on the community as well as industry experts. So, and in fact, we're still struggling with the testing issue right now, and hopefully we'll get that ironed out. But okay, the next person on the dais is Annette Frank. She is the council member from Dayton, Oregon, just across the highway there, and so you're up.
Hi, everybody. The whole purpose I got involved is, can't hear me?
Talk into it.
Hi, everybody. Is that better? Okay. First off, I want to say thank you for everybody coming, and also I wanted to strictly say I am not representing the city of Dayton's views. We haven't come to any kind of decision about what we are or aren't going to do. We've had a little discussion, but not major discussion. So I just want to get that out there, that I do not represent the city of Dayton's views. I am merely coming from it from an elected perspective. And part of the reason I became involved was because we've had some issues in town with people growing their own medical marijuana, which the law allows. But in a small town, and in my perspective, there are issues that complicate so many things in a small town or on any level, as far as a criminal activity and not being able to control who's coming and going to a personal house, as well as the value of your home. All these play a role, and so as we came up against some of these issues, I really felt like a dispensary or a pharmacy or something of that nature was the better way to go than to have people just growing it merrily in their backyards all over the place. I'm not saying that they shouldn't or whatever, but there's so many concerns with that. So that's the whole purpose I got involved. And I also have some very close friends and acquaintances that have benefited quite well from the use of cannabis, and so I can see the use of it and being able to make it available to everybody. But I'm also very concerned about keeping it away from children, and adults who do use it for medical purposes need to be responsible and use their common sense. And it's unfortunate there are a few that don't use their common sense and spoil it for the majority who are using their common sense, and that's my main concern.
Thank you. The last member on our panel is Andrew Gwynn, facility owner from Southeast Portland, and he'll give you a little bit of insight as to what he's been struggling with to get on top of these rules. Andrew?
Hello everyone. Anthony, thank you for allowing me to speak tonight. I really appreciate it. Being young in this environment is an honor. I'm only 27 years old, and I'm trying my darndest to follow through with all the rules that I think are okay, with all of the Rules Advisory Commission, all their rules that they've been put in place here. One of the things that I think is one we should highlight here is that dispensaries are going to operate in Oregon regardless. They're happening right now, and this is even before the license has come into play. Oregon law allows growers, like they've mentioned before, to be reimbursed for their cost of supplies and utilities. And so these growers right now are dispensing medicine to patients, and that's in an unregulated environment. These growers don't card people, they don't card for minors. Like she had pointed out, they're in non-commercial environments. These are entities that are established out of people's homes, so regulating them to be in commercial environments, having cameras, paperwork for everything that comes in the building. We have to keep our records for 30 days for our cameras. The Oregon Health Authority can come in at any time they want and check our compliance with those cameras. Any marijuana that comes in the building has to be signed off, and it has to be also ID, photocopies of every single ID has to be taken care of when it comes in and out of the building. So I think that allowing something to already operate and not regulate it is something that is not smart. Right now, the 3460 is a good start, a good set of rules for us to agree upon a standard that we can all make sure we card people and make sure that the people who actually need this medicine are the ones receiving the medicine, and the people who are not carded are not getting that medicine. And there's rules in place with this committee, or with the ruling here, to penalize those people, remove their license, fine them for those types of things, and they can have their license removed, which they can't operate anymore. So I think regulating it is a must.
All right, thanks everybody. Great opening statements. We're just going to start off with a couple of questions. If you have written down your questions on cards, Bernadette will come up through and you just pass them out to the end of the aisle, or to the middle of the aisle, I guess, where she's going to come up through, and she'll bring them up to me shortly. I just wanted to start with Commissioner Stern. At the request of the Association of Oregon Counties and the League of Oregon Cities, Senate Bill 1531 has been introduced that will allow local municipalities to regulate, restrict, or prohibit. But in the recent interview, you said that your preference is not to ban dispensaries outright in Yamhill County, and that was lukewarmly seconded by Commissioner Springer. So in light of the bill that's coming before the session, and in light of what you've said, what do you think? How do you think we're going to proceed in Yamhill County?
I don't know. AOC, the Association of Oregon Counties, did just recently submit that bill that would allow not just for banning, but for some regulation by the municipality. When we say municipality, we mean city or county. And but I will say, counties are much more limited in how they can go about enforcement because cities have business licenses, so they can pass an ordinance that allows them to not give a business license to a dispensary if they so choose, or if the dispensary does something wrong, they can pull that license and the dispensary can no longer operate. Where counties, we don't have business licenses. So what we would have to do then, if somebody violated, if we initiate an ordinance that sets up some guidelines and a dispensary owner violates those, we would have to take them into circuit court and under a nuisance theory. And we would have to then prosecute them for a code enforcement violation and go through that. So it puts a lot more onus on the county. It would be a lot more work, but I would hope that, I mean, I think an outright ban stating that dispensaries are not allowed because they don't comply with federal law, according to Legislative Council, as you pointed out at the beginning, that's not going to fly. And it seems to me that the Attorney General, when she ran, she said she was in favor of legalizing marijuana. I think it was clear from her staff who were present with the RAC that there's not a lot of interest in being too tough on the rules, that, you know, listening to suggestions from the sheriffs and police chiefs and the DA, then DA Rob Ovett, who now works for the Association of Oregon Counties. And so we're caught in the middle of, you know, we're damned if we do and we're damned if we don't. If we ban them, we'll be sued. If we regulate or, you know, pass an ordinance that regulates somewhat, we'll have to sue and then we'll be sued back. You know, so we don't really know what the right path is at this point, and we're trying to figure it out, and it's difficult, but you know, I can just, all I can say is that I will do my best to work on it and you know, give it the best consideration that I can.
Great, thank you. Sheriff Crabtree, I know you have mentioned on a couple of different occasions your concern about the actual lack of funds to properly administer this program. Could you talk to us a little bit about that?
The House Bill 3460 in law, has nothing to do with the rules. It's actually in the law that allows the state of Oregon to collect $803,000 and some change per biennium. Can you all hear me?
No.
Not working.
Speak into the mic. Go kiss the mic.
How about that?
Yeah.
I don't have germs.
I do, that's why I'm sitting over here.
Where was I? The House Bill 3460, the law itself, not the rules, but the law, very clearly states that the state can collect up to $803,000 and some change per biennium to administer the marijuana dispensary program. That works out to just a little over $400,000 per year. The OHA, the Oregon Health Authority, estimates that they can buy 4 staff with $803,000 per biennium. 4 staff equals 2 field inspectors and 2 office help. They estimate that those 2 field inspectors can reasonably manage between 35 and 70 dispensaries throughout the state of Oregon. I've heard estimates that we may be looking at up to 300 and maybe more dispensaries throughout the state. The governor, as Anthony pointed out, very clearly stated, and this was in a signing letter, and it was as clear as you saw it on the board. He expects extraordinarily vigorous enforcement by the OHA to deal with dispensaries. Those are strong words. Those are your governor. Those are words from your governor. Frankly, I've never heard such strong demands. Extraordinarily vigorous enforcement. So when I was on the RAC, what I was looking at is, can we meet the demand of the governor? Can the OHA provide extraordinarily vigorous enforcement with 2 field inspectors throughout the state of Oregon. Absolutely, I can't imagine how that can happen, and I don't think anybody else can. That's the answer to your funding question. That's just one of some other issues that I'm going to discuss tonight about why I think that this law has some fatal flaws in here that are going to create failure, not only for the communities, but for the dispensary owners. And I know I've talked to some dispensary owners, and they want this thing to be successful. We're setting them up for failure, and we're setting our community up for failure if we have a law that is absolutely broken, and we know it's broken before we even implement it.
All right, thank you. There was some discussion by the District Attorney Bavette about putting in a legislative punch list to get some kind of, correction out of this next session. That is problematic for 2 reasons. One, it's a really short session, and 2, it could impact, if there was a change statutorily, it could impact the way the rules are implemented. And so rather than do that, they've issued the rules as temporary rules, and then after session they're going to come back and go after them again and issue the final rules, and then we'll see if we can get better. But the sheriff is correct. There are some verbiage in the law and now in the rules that really make it tough for the dispensary owners to meet the criteria, for the administrative authorities to administer the program adequately. 2 field inspectors and 300 facilities. That's 180 facilities a year for each person, basically. So you can do the math there. Also, one more quick question, Sheriff Crabtree, is you raised some concerns in an interview about medibles being available in dispensaries. For anybody that doesn't know, a medible is a marijuana-infused edible, hence medible. And they are found to be effective for those that can't or don't like to smoke. They can ingest it and get the same sorts of effects. So, but you were concerned about gummy bears and other, candies and such as that may appeal to younger children, students, teens, and that sort of stuff. If there was an ordinance that prohibited the sale of items like that, or set some sort of standard that wouldn't allow those to be in Yamhill County dispensaries, for instance, is that something you could support?
Well, first off, is this on?
Yes.
Okay. First off, I appreciate that question, because that's one of the biggest issues that I have right now. First off, I think that issue needs to be addressed in the law. I'm not a lawyer, obviously, but I have some concerns about cities or counties trying to regulate what types of, whether or not somebody can serve Doritos or gummy bears or what. I think that it's going to be very dicey for government to try to regulate. But just quickly to emphasize what Anthony's referring to is, as I said on that rack, I knew there was, I'd heard some stories about, making sure that they could, would be able to sell, pot brownies in these dispensaries. Seemed a little odd to me in terms of, is that actually, part of dispensing medication, and is that really the, a needed way to do this? But what I did is I tried to visualize this, and I thanked the lady, I don't know her name, but a lady came into the one of our RAC meetings, and she was a pro-marijuana advocate, and she said, she basically looked at all of us and said, I bet you that none of you have even taken the time to tour a dispensary. And I thought to myself, lady, you're right. And if I'm going to sit on a rack, I think I owe it to everyone to do that. So I went to a dispensary. A little uncomfortable for the owner, I think, to let me in. But I made it clear to him that I was just there to learn more, and he was very gracious and let me in. The problem, and I need to draw a picture of this for you to understand my concerns, is I went in, once I got into the secondary room where the marijuana was, right on the counter, what I saw, Anthony, was I saw gummy bears, literally. They were gummy bears. I saw caramel popcorn. there's other products that are cookies, brownies, other products that are absolutely generally intended for people and kids, and little kids. There was nothing, absolutely nothing that I could tell that these things were bad. I asked the dispensary owner, or the operator, I said, are these laced with THC? And he said, yes, they are. And if you can picture having gummy bears and gummy worms and Pop-Tarts, you all heard of Pop-Tarts? Well, they got Pop-Tarts now. Cookies, hard candies, anything that your children have access to today now can be sold or distributed in a dispensary, which will be taken home. And if anybody in here truly thinks that they can keep gummy bears and hard candy and caramel popcorn and cookies and brownies out of the hands of your kids, I think you need to rethink that. The second week that they opened these up in Colorado, a 2-year-old baby was rushed to the hospital after eating a pot cookie for poisoning. So yes, I have some very serious concerns about that. That is probably my main concern, and I don't know exactly what they're going to do about it, but everything that I say tonight is going to be, it's going to go back to, we know that the law is flawed, we need to fix it.
Thank you. Councilmember Frank, you're in a small city in Yamhill County. I can't imagine you would have the resources to mount a legal challenge or defend a legal challenge for an ordinance that the city put in place banning dispensaries. Can you give us some thoughts on that?
That would be a problem. I know currently we have our attorneys looking at some things and advising us what direction or stance we should take at this moment. Of course, that's up to discussion with the council and where we decide to go with that advice. I have a lot of the same concerns that Jack has talked about, and we are really looking towards the county to give us small cities guidance in what we should be doing, because on the one hand we don't want to create those lawsuits because we definitely can't afford them, but there's another side of the thing too, is if we don't allow the dispensaries, as Mary alluded to, we're going to have another issue with other lawsuits with people just growing it in their homes and us not being able to regulate that or even know what's going on. And I'm not saying they shouldn't do that, but I'd rather see a locked facility that's policed be the place people primarily come to get their medical marijuana. It's going to be a whole different story because a lot of people are trying to rush the recreational passage of that, and while I understand that, I think we need to sit back at least for a couple of years and see how things are playing out in Washington and Colorado before we determine some of our policies here, if we're going to go that direction. And I personally don't have a problem with going that direction, but I'm very concerned about making sure it's kept out of children's hands and the responsibility of adults who use it. And there's a lot of responsible adults, but there's a lot of them that don't. And if we do have cookies and things of that nature that they're infused with, there's got to be some mechanism to make sure that we can protect our kids from getting sick or being poisoned or whatever. But it's really dicey, and it's kind of scary, honestly. I mean, it's a great thing and it's very therapeutic, but it creates so many different problems at the level that I'm at in terms of complaints and ordinances and smells and people's having homes next to a rental and the guy can't rent it because they're growing marijuana there. And then you've got 14-year-old kids coming down the street and they can smell it. And I literally heard this 14-year-old kid say, "Oh my gosh, you can smell it. It's just there for the taking." That's a little scary, you know what I mean? And so if we truly want to protect our kids, but also be compassionate, we've got to find some kind of policies that work to protect our kids and definitely educate the adults about protecting their kids.
Thank you. Andrew, I know you're really buckled down trying to meet the criteria of these new rules that they've put out, and I know, having been in your facility myself, that you have, you have popcorn. Is that what they're calling it, popcorn? And you have the medibles and the things of that nature. Given the fact that minors aren't allowed in any part of the dispensary that where marijuana is present, and that only adults are allowed to, purchase the medical marijuana, what are your experiences and what are you seeing now? I mean, do you get a sense that these medibles are finding their way home to the children, or you find that typically the patients, have locked storage for their medications and things of that nature? So you give us some insight onto that.
With my experience in dealing with patients is that some of them do have kids, and it is obviously a concern keeping marijuana out of the kids' hands. A lot of patients, though, on the other hand, they can't smoke it. There's a lot of people that have respiratory problems, and just even the idea of smoking it is not going to be good. For them, the alternative is to consume it. Albeit there is non-medical or edible ways to do this. There's hash pills, things that don't necessarily resemble edibles, but under the definition of the guise of the law, it is still considered an edible. It's something that you ingest. It's not marijuana that's smoked, so the person can actually use it medically beneficial instead of having to inhale the fumes and all those things that could be potentially harmful for someone that's doing that. So the medibles, I think that it in being in like gummy bear, for instance, is a concern. But there are also alternatives out there so the person who's trying to find that medically beneficial aspect of the marijuana doesn't necessarily have to get a gummy bear. They can get an RSO pill that's just a straight extract. And so when we talk about the regulation of pills, well, it's got to be common sense of adults to be able to lock it up in their cabinets and that type of thing. So I think there's ways around still allowing medibles, but making it to where it's not sought after when it comes to the eyes of kids when they see it lying around, for instance.
One more question, Andrew. How are you, I know that the rules require some pretty stringent tracking of marijuana that's being transferred in to the facility as well as being transferred out. Do you find those rules to be adequate? And do you foresee any diversion of usable marijuana into illegitimate channels?
I think that the rulings placed so far are adequate. They do mandate a photocopy of IDs every single time marijuana is brought into the building and out of the building. These growers obviously are registered from the Oregon Health Authority. There's data on them. Patients as well are registered under the registry system. So I think that the photocopy idea actually is a good start. It's going to deter the people that are going to want to do criminal activities from even putting their information on the line in the first place. And I think what it also does is it helps with the 5% rule. The Oregon Health Authority has actually allowed 5% of us to have for moisture loss and breakdown of handling and processing. I think the 5% is adequate. It allows facility owners to justify the cost of the moisture loss, but it isn't a high enough number for them to potentially have diversion of marijuana going out of the building. All entrances and exits of the facility must be on camera from 15 feet outside of the facility. So, I mean, when you have people coming in, they can only step foot in the building after being reported. So, I think it's adequate to deter the people that don't want to do the legal activities.
All right, thank you very much.
Anthony, I'm sorry. Can I just add one?
Yes, absolutely.
Hold on.
I think that's a really good question in terms of diversion and what may be misused going in and out. But I want to point out that the House Bill 3460 allows a person with a medical marijuana card to go into a dispensary and purchase 24 ounces of marijuana. And for those of you that know ounces, that's 1.5 pounds. if you break 1.5 pounds of marijuana down, you can roll up to 1,800 joints. So when we talk about diversion and possible misuse of the marijuana, it's not going to happen on camera. I can go in, I can get my 1.5 pounds today, and I go back tomorrow and get me another 1.5 pounds. I don't know how long it would take somebody to smoke 1,800 joints. But there's absolutely no controls on somebody going back the next week or the next day and buying another 1.5 pounds. So the diversion isn't going to occur on camera, and it's not going to occur on paper. You just need to understand that.
Well, Andrew, what do you think about that? I know that a lot of facilities don't allow for a patient to actually come in and purchase that much, and would never allow them to come in and purchase that much again for the next day. So can you speak to that?
Yeah, 3460, he is correct. It does allow facilities to transfer up to the allowed amounts of each person. But then again, 1.5 pounds for people that have high medical needs. Rick Simpson oil, if you break it down into a concentrate, you're not left over with 1.5 pounds. That's not many people know about the Rick Simpson oil and what you're left over with. So I think that those patients that have that high medical value going through rigorous cancer treatment, they do need that extra concentrated benefit of all that.
Okay, thank you. You know, we're starting to run up against the clock here a little bit, so one of the questions that came in from the audience was, how many card holders are there now in Yamhill County? I can answer that. There's about 1,025 patients in Yamhill County. I do not know how that breaks down as far as growers and caregivers, but that's the number on the website right now for Yamhill County, 1,025 patients. And here's a question for everybody, I guess. What does it mean to OMMP cardholders if the county and city of McMinnville decide to ban dispensaries? In other words, do we want to send them to Marion County or Multnomah County and let those counties get their money, or do we want to keep this stuff? Do we want to keep it here? Yeah, sure. And a response from each of you.
Well, you couldn't have said it better, Anthony. In all honesty, here's the deal, and I've said this twice already. This law is flawed. And if I have a chance, if I don't, I'll share it with you later. This law needs to be referred back to the legislature in 2014. That's next month, 1 month session. They're telling us that they can't hear it. They've got too many important things to hear in February. I say this is critically important. You don't take something that you know is broke and try to run it. If you know you didn't put oil in the car, don't start it. So what I'm saying, what my recommendation is and will be, let's take a breath here, let's get this thing fixed, and if it gets fixed and we're happy with it, let's implement it.
What's broken?
You want to know what's broken?
Yeah,
Can I
what's broken?
talk? Okay, here, let me put this away.
We'd like to hear from some of the other people.
Yeah, we'd like to hear
Well,
from
somebody
you.
asked me.
I asked it, what's broken?
Okay, thank you. I got the floor?
Yep.
Okay, I think I've mentioned a couple things. One is I
Not
really...
what you, not what you say,
Well-
what's broken?
You asked him what was broken, let him answer
Yeah,
the question.
just let me talk here for just a second, and Anthony can stop me when we're done.
Okay, we're done. No, I'm
Yeah.
Go ahead.
First of all, this really, I'm trying not to be about what I think. I think these are facts. And when I talked about protecting kids, I really don't think there's anybody in this room that's not interested in protecting our kids. Now, that's one thing. That's really not my opinion. Do you all know, and you heard from Anthony, so you do know, that a person who works in a dispensary dispensing medication to my sick grandmother, who is under the guidelines of the governor to provide a safe environment for people to get their medication, is allowed to step back in another room and smoke weed. Then they come back out and they dispense medication. I think that's a broken, that's a flaw in the law, and you can argue that if you'd like. We've got the district attorney for Los Angeles, Jackie Lacey, sent our governor a letter. Please, don't do this. Don't go down this road with dispensaries. Our crime rate has increased exponentially. We've had 9 dispensary-related homicides since 2007. Our reports of car break-ins have gone up greatly. We've had, basically our crime's gone up
Due to
around this
marijuana or due to something?
dispensaries.
They're
Dispensary
those-
related
all
is
those
what they
crimes
say.
were related to
So,
marijuana?
I mean,
at
liquor
any
stores
rate,
get held.
pardon me? Somebody say something?
Go ahead, Jack. We're going to open it up here in just a minute, so just be patient and we'll open it up to everybody else.
So there's some, I've got 11 points. And there again, I know I sound compassionate, I know that's a word that Anthony appreciates, but the fact is, I am truly trying to stick to the issues of the law that need to be addressed by the legislature. And the RAC discussed these. It's on a punch list. We just want the legislators to consider them, have perhaps some feedback from people other than the people that they had on the RAC, which we had 3 public safety and 10 others that were mostly pro-marijuana. There was absolutely nobody from treatment, there was nobody from mental health, and there was no physicians, the people who have to deal with the medical outfall of these issues. There's some work that needs to be done on this, whether you like my point of view or not. I'm telling you what I think needs to be done. If we're going to protect our community, we need to stop, we need to look at this, not get in a big hurry, and do it right. If it can never be done right, for maybe it's not meant to be. In the meantime, I say we don't do it until we get it right. And if you would actually like to hear more about my points, I'd be glad to do that.
He'll buy you coffee afterwards in the rotunda. So, but I have heard several of Sheriff Crabtree's concerns, and I think they're legitimate in the sense that even the people that advocated for this law were concerned that there were some fixes that need to be done. The sense in the building in Salem is that the session is so short that they're not going to get to it. They're going to readdress the rules after session and then finalize them before the election. And then in 2015, after it's worked for, or not worked for a few months, then they'll come back in with a punch list from both sides, because both sides have a punch list. The law enforcement and public safety side has a punch list, and the facility owners and administrators have punch lists. So just going to have to be patient and make sure that everybody's being responsible. So I am going to go ahead and open it up for questions. Just kind of come up to the microphone if you don't mind, and line up and address your questions to the person you would like to answer them.
I'd like to address this question and comments to the compassionate Oregon people. As far as I can tell, the dispensary law is not in compliance with Article 1 of the Medical Marijuana Act. The Medical Marijuana Act in Article 1 says that marijuana shall be treated like all other medicines. This is far from the truth. Let me give you some examples. Marijuana is a psychoactive drug. Everybody can agree on that. It changes moods and it changes behavior. If we compare it to another psychoactive drug, let's say Valium, which I'm sure most of us are familiar with, then let's see how the rules apply. Valium, when it's ordered by a physician, is limited to 5 refills or 6 months before it is reordered. With medical marijuana, once you get your card, it's yours for a lifetime. Nobody.
No. 1 year.
All right, it's valid for 1 year. During that year, nobody will monitor your dosage. As Sheriff Crabtree said, you can buy 1.5 pounds today, go down the street to another dispensary and buy another 1.5 pounds. Nobody regulates that. Other psychoactive drugs, such as Valium, have to be dispensed in a child-proof container. There's nothing in the dispensary law that mandates that. Other psychoactive drugs are not given as popcorn and gummy bears. Marijuana is.
Do we have a question?
Yes, as soon as I finish.
Well, we have a lot of people wanting to ask a question, so could you get to your question, please?
All right. Physicians that order psychoactive drugs are monitored by the Medical Board of Oregon. Not so with marijuana. So my question with you is, how can you say that dispensaries are in compliance with Article 1 of the Marijuana Act when such is not the case?
Who wants to take that one on?
I think the lawyers.
I can take one point. I know that there is such a thing as a fentanyl sucker. So that's a psychoactive drug that's in candy. I know that's an aberration, but it does exist. I totally agree on the childproof containers. I would have loved to see that thrown in there. Yeah, there is a conflict there with the way that's worded. Part of the problem is that because the federal government has kept us from studying marijuana, there is no way to tell people what the dose is. I mean, I work at a medical marijuana.
Talk to the microphone so they can hear you.
Can you not hear me? Pretty loud voice. I work at a medical marijuana clinic, and we try to help people out, but we can't. Obviously, we can't advise them on dose. It's different for every person. So, I mean, there's just some problems that are already underlying the whole act because of the Schedule 1 and the federal government and all that. So, I mean, this thing is not going to come together until something happens with the feds, and we're kind of stuck with what we've got right now.
Well, and to follow up on that is also cannabis at the federal level is a Schedule 1 controlled substance, and it cannot be prescribed by doctors. In Oregon, they've rescheduled it to be a Schedule 2, but it's still tricky because the doctors are always under constant threat of losing their DEA number and not being able to prescribe other medicines in the course of their practice. It's a very tricky situation. There's not a medical marijuana patient in this state that wouldn't like to see marijuana treated as other medicines, that they're in properly dispensed, properly tested, properly monitored, they're in childproof containers, they're adequately and properly labeled. They're all support for that, but too many times when these sorts of issues have come up, the Oregon Health Authority has poo-pooed the advisory committee on medical marijuana and said, well, that's not really important, that's not really the direction we want to go, and so no action is taken, and then we get a bill like 3460 that starts pushing these people, and pretty soon then you have a piece of legislation that didn't get properly vetted and has some problems, and we hope to get in front of the legislature as soon as possible and get them fixed. And it's not just the pro people, but the anti people as well. So, you want to take a comment, Mary?
No. What was the question?
Well, the question really was, why don't we treat marijuana as marijuana in all these dispensaries? And will the dispensaries really follow the rules and treat it as medicine?
I liked her point here before. We're not giving the doctors the proper tools to be able to do what they can do anyways. Under the law, it's recommended, it's not even prescribed. So you have those problems inherently. And then go back to the kids. Right now, you can get 1.5 pounds from a grower multiple times a day. You can get more than 1.5 pounds illegally. There's nothing regulated with that whatsoever. The diversion of kids, that person can take all that marijuana to home. It's the same problem we're all existing with. At least with this, you have a simple mandate of packaging, where at least when they get that packaging from their dealer, albeit a storefront now, it is labeled to have the children's warning label on it. Beforehand, you get an unmarked bag that doesn't have anything written on it at all whatsoever. You don't know what kind of THC levels you're getting or nothing. It's completely unregulated right now.
In addition, you're going to be spending a lot more from a dispensary, and you're not going to be able to resell that product because you're spending a lot more in a dispensary than you would be on the street.
Yeah, the black market value of marijuana is a lot cheaper than it is going to be in the regulated
And the quality of the product these patients sometimes get are full of impurities and things that can make them sicker, whereas if it's in a dispensary, it's going to be tested, it's going to be regulated, and the price is going to be higher. You're not going to be able to go out and resell product like that. So up the price.
If folks have comments or questions, could they please go up to the mic so everybody can hear them?
Yeah, line on up. We're going to give it about another 20 minutes, and then we're going to kind of wrap it up with some closing remarks and all that. So go ahead.
I'm sorry if I missed this. Anthony, can you say what the fix would be to the bill?
Wow.
That's too much.
Well, I will tell you that Compassionate Oregon, after the second version of the rules was submitted, we put together a 14-page critique and came up with a lot of things that need to be changed, like, you know, right now the patient owns all the marijuana, but yet the grower can make a deal with the patient and the facility, and the grower gets paid the money. I think that's a flaw, and I mean, they're just. I mean, Sheriff Crabtree has a list. The proponents have a list. The testing situation right now with cannabis is still up in the air, and if not changed, may actually bring the whole program to a screeching halt because of the inability of inexperienced rule makers of writing the rules. I mean, you have a committee that admitted not knowing a doggone thing about testing, not knowing anything about herbs. The guy from the pharmacy board didn't know anything about herbs, and they've implemented testing that will require such a low amount of microbial parts getting onto the plant or into the cannabis that it can't be tested. And you've got a symbiotic relationship between microbials and plants. So it's a big problem. There are a lot of problems, but given what we have, and given that it's going to become effective on March 3rd, and people will start, well, it's effective already, but the rules and applications will be, you can start applying on March 3rd. They're going to let it fly, and come 2015, they'll come in with a big list of things that they want to change, and hopefully we'll get a much better law. I lobbied in the 80s for this issue, and I took a break for about 20 years, and I got back into it a few years ago because having read the law itself, I said, wow, we got to make some fixes here to better protect the patient, better protect the facility owners, and better protect the public safety. So it's there's a lot of things that could be fixed, and we'll just have to wait and see, I think. Next question?
Okay, I just take, first of all, I've been part of this thing from the very beginning, from Dr. Levesque, and I'm part of Normal and THMC and all Stanford and everybody. What it comes down to is basic adultness. You know, the politically correctness, we understand that, but we're adults, so we have to, the liquor store, you have to take care of that. You have to be an adult and quit telling people to tell you what you're supposed, you know right from wrong. We don't have to be told. When we were children, your parents told you, wait till you're 18, you get to make your own decisions. I'm almost 60, I'm still not making my own decisions because I haven't somebody telling me what, when, and how long to do something, and I'm still an adult. I have children myself. I'm a card holder, been having. First number was 00004. That's how long I've been in this program. So, you know, we have to learn to be adults, and we know how to take care of our children. We understand how to do all this. So what we have to learn to do is, it's not all about money. You know, it's a patient thing. And the money comes along, but everything is about, the first thing out of anybody's mouth is money. You know, that's the first thing. And like, we voted for this law, and now the little municipalities and everything are trying to supersede the law by making up, well, we don't want this in our town, because, but why would we vote? It's like somebody voted for you, and then after you won, they came up and told you, well, you can't do this now. Well,
do we have a question?
No, it's just a statement.
Thank you.
Could I just address a couple
absolutely.
things? I get it. We are all adults, and we should be able to make decisions that impact our own lives. However, the three of us here, when we became elected officials and were sworn in, we each took an oath to uphold the constitutions of the state and the United States and uphold all the laws. So we've been put in a conflict. We can't do both right now, and that's what's problematic.
You can't protect
and not
myself
only
from myself.
What's that?
You can't protect me from me.
I know
So
that.
how does that work?
But you have to just put yourself in my place if you took this oath, and that oath includes upholding state law, upholding federal law. The state laws are conflicting as well as regarding land use. There's an ordinance that requires state agencies to coordinate. So we, the local jurisdictions, have to pass have to issue a land use compatibility statement to any of these other state agencies, ODOT, DEQ, water resources. We issue these to say what this person wants to do on this portion of land is okay by the land use laws of the state of Oregon. Well, the OHA, they don't have a requirement that the person who register come to the county. They just say, you might not be compatible with land use, but you might be. But that's not our concern. They're wanting the county then to, on its own, figure out where you are, and if you don't comply, then we have to go after you and enforce the laws. We're just put in an untenable situation, and it's just very difficult. And I get what you're saying. I looked online today for pictures of the candy. They had Kit Kat bars and what looked like Kit Kat bars. I can't remember the name, and Oreos, and they looked like that. The packaging was similar, but it was the THC infused whatever, and or Medibles. And I was reading the comments underneath, and they were really interesting, but talking about people saying, they look like these cookies and candy and sugar and all this bad stuff, and that could go into our children's bodies. And someone wrote and said, you put it in without the THC, that, all this cookies and junk and candy and all of these things that are harming your children and causing them to be obese. You don't seem too concerned about that. Why, what are you worried about? But it just points out what an odd position we're in here. And it's just very strange.
I wanted to say that many of the concerns that both opponents and proponents have are really the same. They're really not that different, and we all have this concern for our children and their safety, and making sure that they can grow up happy and healthy without any interference, especially from dumb adults. It's unfortunate we have dumb adults, but really, the concerns are very much the same, and the law is flawed. We have many laws that are flawed, many laws that are flawed, and oftentimes we don't know how flawed they are until we actually roll them out and run them and figure out what we need to do to change them. So while I am not happy with some of the things with the law, I think there are lots of things we can still do to improve the law that will give the county and cities some sort of guidance and direction that will help us to better manage them, I guess, if you want to say. Because I personally don't want to prohibit them, but I do want them policed and taken care of and that sort of thing. And I'm very concerned about kids. And so that is my main concern. But one of the other things I wanted to mention, not to bring up a can of worms, but because I am sort of an advocate for
gummy worms.
Gummy worms. No, is the fact that while I'm a little conflicted about a dispensary owner being able to smoke pot, I kind of also equate it to, well, what about a store owner that comes in and has a prescription for something and they have to take it when they're working? What really is the difference? You know what I'm saying? Especially if you're using it for medical purposes. There is a concern about doctors being more involved, and I am all for that, because we definitely need to start understanding, what the dosages are, how we can use them. I mean, there are many cases where now even some small children in other states, in very serious conditions, of course, in very small amounts, they're helping them not to have seizures and that sort of thing. So, there's a good part of it that we need to use, but we need to make sure that we protect people as well. So that's my thing.
We're getting close to the end of this thing. Let's take these last three people that are in line, and then I've got one final question for all the panel members, and then we're gonna close it up, go downstairs, and have a beer. And for some of those of you that believe in the Budweiser commercial, you know, grab some buds. But anyway, go ahead.
I have a question concerning the industry side of this. I hear a lot of people, I mean, you're all comparing marijuana to a drug that you would find in a pharmacy, like Valium or Vicodin or anything like that. You're trying to move it toward being a medicine, where as pharmaceutical companies make money, they make a profit. And is it fair to compare marijuana to pharmaceutical drugs? And then is it fair to the industry to say that you can't turn a profit, that these dispensaries aren't going to be able to turn a profit, where you're trying to put these pharmacy restrictions on a facility and say that it can't have the same opportunity to turn a profit? I don't quite understand that.
Well, just in fairness, we're not the ones that made the law.
I understand that. I'm saying in your opinion, from your view.
But as far as us trying to turn it into medicine, that's not our role either. The HB 3460 refers to it as medicine. The person who gives the medicine gives it to patients. This is what the law says. And that was referring to the to this issue regarding pharmacists. But a pharmacist, I can assure you, will be sent home if they go to work, if they show up for work and they're impaired. They're dispensing medication to patients. The law says that these are patients and it's medication.
And we're rehashing the situation is what we're doing. We've already heard this.
I understand that you know, that you want to put these restrictions on the members of the facility, which I don't disagree with that at all. I don't think that they should be able to be high on the job, period. I don't think you should be able to be high at any job. But from my perspective, you're trying to put these restrictions on it as a pharmaceutical drug. I mean, you're saying, all right, not as a pharmaceutical drug, but you're telling people they can't be high on it, they can't at work. You're putting it in the same category as these other drugs, and yet not giving it the same opportunity as these other drugs in the form of companies being able to make a profit.
I think that's changing, and I think that's going to play a huge role in whether or not it's going to even pass being recreationally used. That's why so many people are trying to push it so fast through legislation right now, because they want to make money off of it. But in the meantime, they're forgetting about the safety of our families and children. And there shouldn't be any reason that they can't make money off of it. I don't have a problem with that, especially if that money can be used to improve different things with the state, as well as enforcement issues that are a huge problem. I mean, we can then pay for that and have a lot more people go out and check it out. So
from my perspective, I'm a grower right now for patients. I grow for a cancer patient, for a Parkinson's patient. And my problem is that, I mean, how am I going to be able to sell this to a dispensary and not break a law if I'm not turning a profit?
Well,
that's my concern.
Right, and that's something that should be changed, in my opinion.
But I think that's exactly it. You're pointing out another flaw in this law, and that's the contradiction with what the gentleman was saying earlier about, you know, is it a drug? Does it fall? It doesn't on the federal schedule. It does. It's different on the state schedule, and so there's that conflict again. It's a mess. Yeah.
Let's go to the next question, if you don't mind.
I just got a statement. I'm a disabled veteran. I have a free choice of my medicine. Now, we're being denied that by people that stand up in front that say, well, we don't want our community to do this. We don't want it in our neighborhood. We don't want it in our state. But the state has already spoke. The public say, we have the right for choice of medicine. I can go and I could take morphine, or I could go to the veterans and go get Oxycontins, but my choice is natural. I've got a bad liver from hepatitis when I was 12, and you know what? I want to protect it. And my pain medicines, and my PTSD, and my COPD, and my arthritis is all treated by medical marijuana. Simple. We have the choice in a free society to do as, well, we say a constitution. I don't know what a constitution is, I'm sorry.
Thank you. Next question, please.
Hello. I'm not sure that I have like specific questions, but I believe that this is a really, sorry, I'm not used to speaking.
It's okay.
This is a really good opportunity for us as people to reevaluate what compassion really means. We have economic issues, we have medical issues, you know, we have the stigma of marijuana, we have the criminalization of people who just need medication, and I believe this is an opportunity to change the agenda, to change the mindset around marijuana, because it is, you know, it is up to us to determine where we want to go in this life, in this world. And if we move towards compassion and we move from our hearts, we will make progress. We will move past these flaws, these questions, problems everyone has, but we do have to look at what we're doing as far as medication, laws, economics, all that is coming together in this issue. And I think that we need to talk more about that. Not more about, you know, I do this and I do that, and, you know, we all understand, we've all agreed that marijuana is beneficial for some people. Not everybody wants to admit that, but it's happened and it's out there. And I also believe the economics of this is very important, very important. Monies that have spent, you know, been spent and allocated to criminalize, you know, to pursue this, you know, criminalization of marijuana can be redirected to other things, to going after people who, you know, abuse prescription drugs or have, you know, the pills, they look like candy sometimes. Those are prescription drugs. We all know that is out of hand, and I understand the fears of children finding, you know, edibles or medibles. Anyway, so, you know, there is a real chance. I want everybody to understand we have a chance here to move in a completely new direction, to decriminalize this, to move on, get our economy going, help people feel better. Then they will make the right choices. Do you understand? Heal the people so that they understand what is a good choice and what isn't. When you're dealing with sick people, how can you expect them to act appropriately or follow laws or even comprehend what is right and wrong? Okay, we need to start healing the people, redirecting these agencies and government and looking at what their agenda is instead of going deeper and deeper and deeper into laws and regulations. I think we have a real opportunity here, and I really want everyone to spend some time on what is compassionate, you know, what is compassionate for the children, because I am a mother, I'm a grandmother, and I'm really afraid of what's happening in our country. And I don't want this to become another stepping stone for evil agendas, you know, that have no place in a loving, compassionate society, that we have a chance to grow here in Oregon, where I was born. And I love it here, and I don't want anything to get worse.
Thank you.
Thank you.
I have one final question for the panel.
There was one more lady.
Oh, there was is there somebody hiding?
Yeah, she was hiding. She was up there all along.
See, I can't do that. I can't hide behind the post anymore. Go ahead.
I'm not much of a public speaker, but
That's all right. She'll hold your hand right there.
I'll hold her hand. It just seems to me that the regulation, the main issues that they're having is the lack of regulation that went on for so long. And it's, I know they're trying to regulate, but like the woman said, the problem that we're having is we're pricing ourselves legally out of the market. And I mean, I'm just sitting here watching it happen. I'm glad it's finally happening, because the real danger to me is when people are accessing, doing what they have to do to get by. And I watched mom do it, and I watched dad do it, and I'm just really grateful that there's an opportunity now that I don't have to feel like a bad person. I can have some dignity and have my medication these days. But I agree that there's a huge problem in the regulatory, because it's too expensive legally. And, like you said, we don't want this going illegally. We want to fix that.
Thank you. Well, my final question to the panel is, in light of the fact that dispensaries are already operating clearly outside of the law, and now we've got a law that brings them under the authority of a state government agency. They're licensed, they're regulated, they're inspected. Why would we not make allowances for those businesses that are operating outside the law now to bring them in under the law? I mean, if we're gonna, I know there's a couple of 3 dispensaries in Yamhill County right now, so why, once we get them licensed and regulated, do we want to ban them? Should we? Or should we let them, come to fruition and provide a very needed resource for patients that can't get marijuana for themselves?
Well, can you hear me?
Yeah.
I'll go back to, I think that's a good question, but the problem is it doesn't address the issue. The issue, it keeps going back to, we've discussed a lot of flaws in the law. Let's get them fixed. Let's look at this. Let's get something that we know, or at least believe. I mean, there are laws that are flawed, but I would hope that at least when they were enacted, at least at the time, that there was some belief that they were correct. We all know, and I don't think there's anybody in this room that would disagree with the fact that there are flaws in this law. Let's get it fixed and then take it from there. But the issue did come up at the racks about sort of what Anthony's saying, and here's what my take on that is. If you have somebody that's operating something below the law, against the law, should they be rewarded at a time where perhaps folks that have waited to do things legally, now the people that have waited are going to be penalized, and they're going to be behind the 8 ball because of the people who have been doing it illegally, who have had their businesses in place. Should we reward them and put them at the front of the line and reward them with a license? That's the question. I don't have the answer to it, but I've always been kind of a firm believer in do things right, best you can, and stand in line. And when your number's called, then you take care of it. But as far as businesses that have been operating illegally, as far as grandfathering them in as a legitimate business, I personally have an issue with that.
I think they're brave pioneers.
They may be.
Somebody had to start. The liquor store started that way.
They did. It turned out to be kind of a bad thing too.
The liquor store started that way.
Well, I don't know of the dispensaries, illegally operating dispensaries in Yamhill County, whether they're in the cities or in the rural area. And just to touch on something Annette said, if we were to pass an ordinance in the county it would not include the cities. So if you're within the city limits, that county ordinance would not apply. So we're pretty limited, I think, county as a county in where we would be restricting, because the areas out in the rural areas are pretty slim. Although there are probably several, and I think Jim has one in mind, and so the law goes into effect in March, and people are going to be applying for dispensaries. So we're stuck in this catch-22, but we have to decide which road we're going to go down and figure it out from there. And I'm only one voice on a board of commissioners with 2 others, and we had a really great, thoughtful discussion about it last week. We'll have a public hearing next week. We'll have more thoughtful discussion. You saw in the paper, Commissioner Springer had a family member who benefited from it, and so we understand the compassionate side of it and the need for compassion. But again, we're stuck back in that position where we're conflicted by the oaths that we took.
This is kind of a hard question because on the one hand, I think some of the guys that are operating illegally are conflicted about how they are supposed to go about getting legal. And it's really, God, it's such a touchy situation because of the way the law is written and everything. I would like to see them have the opportunity, given maybe a grace period, to come to meet the law. And then if they don't do so by that time, then they lose their ability to do so. But it is very similar to the days of Prohibition, and we need to think about how that has worked or hasn't worked as far as alcohol and all these other things. We have history to look at to give us an idea, and we still have problems. We have lots of laws with alcohol, and we still have lots of problems. So just making more laws doesn't necessarily mean it's going to change anything. I mean, that's the same with gun laws. Everybody's up in arms about, more gun laws being passed, because the laws don't necessarily stop the criminals from doing what they're going to do. So let's legitimize what we can and regulate, and that's the best way, I think, that we can do that. And by getting everybody, proponents and opponents, in on the conversation from the get-go is what should have done before the bill ever went into effect, with real people like the audience, not just legislators who have their own agendas. I think a better bill could have been written, so I encourage everybody to write to your representatives and say something to them about this law, proponent or opponent. There's some changes that definitely need to be done, and that's where I stand.
Obviously, I'm not from the area, so the specific question is, shall Yamhill County allow for the allowances? I personally think that from what I'm doing as far as the activities involved in my dispensary, I do think that I will be ready for the rule changes, and I also will not be conducting activities during the application process. So when you're saying operating under a time when they're not supposed to be, I won't be, and I am also operating under current law right now, which allows me to operate. So it's again kind of a weird situation. I agree with every single person on this panel that it's not a perfect bill. There's things that are wrong about this, and again, what she just said, pro or con, contact your legislatures. Tell them what's wrong with it. The community support is what we need for this.
All right. That's how it wraps it up for the evening. I really want to thank everybody for coming. Do please feel free to go downstairs and have a bite and some libations. They have the best tater tots in town here, and they come in a big old bucket, so enjoy that. I want to thank the members of the panel. Thank you, everybody. Thank you. And again, next week, the County Commission will be taking this up. The following week, I believe the city will be taking it up, so I encourage everybody to get active and attend those meetings and let them know how you feel about the new laws. Thanks everybody again for coming. Enjoy the rest of the evening.
Thank you. This is Mercy TV.
You want to say anything before I turn it off, Glenn?
Yes, good night.
Good night. God bless you all, every single one of you.